Hi, I'm Dr. Michael Horn. I am the breast guy. I do the most breast augmentations in Chicago, and I wanted to talk today a little bit about what the difference is between mid-range profile implant and a high profile implant. Many patients come in and they're a little bit confused about what the difference is. Maybe they think the high profile comes higher this way, but actually it's not. It's the opposite. A high profile for the same size implant will be smaller this way and bigger that way. So what we can do, what really helps is to look at the actual implants to see what they look like. Here I have two implants. This one is a mid-range profile and this one's a high profile. So what you can see with these two implants is that the width of the implants, or the diameter of the implants, is approximately the same. But this high profile implant sits higher this way. So for the same width of implant, it's actually about 100 cc's larger. So it would fill a larger bra size for the same width. So when used properly, we try to get an implant that's about the same width as your natural breast footprint, because that way it doesn't leave a big gap between the breasts. Patients don't like a big gap between the breasts. So by finding an implant that's about that wide, then we can determine which ones in that range will fit. That way you can figure out what size you want the breast to be overall, where the high profile would make it a larger breast with the right width. And some patients, if they're real wide to start, would prefer this mid-range because it gets a wider, wider breast so that there's less space between the breasts. Some patients with a very narrow or petite frame would prefer the high profile because it's the right width for their narrow frame and still give them a size that's big enough for what they want. And there's some patients that are sort of right in the middle and they can do either one depending on how big they want to go with the breast and what look they want. So what really helps is to look at some pictures of patients that have one or the other. On our website, chicagobreast.com, we have some really good actual photos of real patients, models, and some of them are high profile, some of them are mid-range profile. So I think it really helps to kind of look at those pictures to get some feel for which look you may like. The other thing we do in the office, which is really great, we have this really cool 3D imager that takes pictures in different angles and then recreates a 3D image of your body. So it's actually your body. And then we can look at the different styles of implants in your body and see what they look like on you and give you a really good idea about which one you may prefer. These implants here are what we call gel implants or cohesive gel implants. And mainly patients, most of my patients prefer these implants. In fact, almost all my patients are getting this type of implant because it feels more natural. When you go to feel it, it feels more like a breast. The saline implant, which we also offer in my practice, you can feel, but with those you can kind of feel the implant a little more easily. You maybe you'll feel ripples or see ripples if you're real thin. And so that's why so many patients really prefer these. And even so many patients that used to have the saline implant and switch to the gel implant like it a lot better. And that's why generally I recommend the gel implants because I think patients like them a lot better. And if you're my sister or my girlfriend, I'd say get the gels.